Individuals with BPH or an enlarged prostate often opt for natural treatments over medication for several reasons. One key reason is to avoid the side effects associated with these drugs, such as sexual dysfunction, dizziness, or headaches. Adopting natural methods typically involves lifestyle changes like improved diet, increased physical activity, and stress reduction. These changes not only address prostate issues but also enhance overall well-being. Natural remedies are often more aligned with personal health philosophies and past positive experiences. Additionally, they can be more cost-effective compared to prescription medications, which is beneficial for those who are budget conscious. In some cases, natural approaches are used in conjunction with medical treatments to maximize benefits. This video focuses on the advantages of treating an enlarged prostate naturally, rather than relying on medications, and discusses the negative impacts of certain BPH medications. Please note, this video is purely educational and is not a substitute for professional medical advice. 1. Diuretics. Diuretics are drugs that help remove extra fluid from the body by making you urinate more. They're often used for high blood pressure, heart failure, and some swelling conditions. But for those with an enlarged prostate, diuretics can be tricky. These drugs work by making the kidneys get rid of more sodium, which also pulls water out of the blood. This lowers the amount of fluid in your blood vessels, which reduces blood pressure. However, for men with BPH, this can make their symptoms worse. BPH means the prostate gland is bigger and can press on or partly block the urethra. So more urine production can make problems like frequent urination, a weak urine stream, trouble starting to urinate, and needing to go a lot at night even worse. In severe BPH cases, there's a risk of not being able to empty the bladder completely, which is serious. Diuretics can make the bladder too full, especially when urine flow is already limited by the enlarged prostate. Over time, this constant need to urinate more can lead to bladder problems and a range of urinary issues. So, using diuretics for BPH needs careful medical supervision to balance the benefits and risks. 2. Tricyclic antidepressants. Tricyclic antidepressants, mainly used for depression, can be a concern for those with an enlarged prostate. These medications impact the body's use of acetylcholine, a key chemical for muscle contraction, including in the urinary system. Acetylcholine helps the bladder muscle contract to initiate urination, but tricyclic antidepressants block this action, leading to weaker bladder contractions. This can cause difficulty in starting to urinate and a weak urine stream. For someone with BPH, where the prostate already partially obstructs urine flow, this effect of tricyclic antidepressants exacerbates BPH symptoms like frequent urination, urgency, especially at night, and a sensation of incomplete bladder emptying. Additionally, the combined effect of weakened bladder muscles due to these antidepressants and the obstruction caused by an enlarged prostate can significantly increase the risk of complete urinary retention, which is not only uncomfortable but can also lead to infections and urgent medical situations. Tricyclic antidepressants might also interfere with the effectiveness of BPH medications. 3. Antihistamines. Antihistamines, often used for allergies, can be problematic for people with an enlarged prostate. These drugs work by blocking acetylcholine, a chemical that helps muscles contract, including those in the bladder necessary for starting urination. When antihistamines inhibit acetylcholine, it becomes more difficult for the bladder to contract and initiate urine flow. For individuals with BPH, where the prostate already narrows the urinary passage, the effects of antihistamines can worsen urinary symptoms. This combination of a constricted urinary path due to BPH and reduced bladder contractions from antihistamines significantly increases the risk of incomplete bladder emptying or even total inability to urinate. This can be not only uncomfortable, but also lead to infections and urgent medical situations. In summary, antihistamines can exacerbate BPH symptoms, negatively impacting the life quality of those affected by this condition. 4. Decongestants like pseudoephedrine are commonly used for nasal congestion, but can be troublesome for those with an enlarged prostate. These drugs act on alpha-adrenergic receptors, which help control actions like narrowing blood vessels. This is effective for reducing nasal swelling, but these receptors are also present in the prostate and bladder neck. When decongestants activate these receptors, they cause the muscles in these areas to tighten. For someone with BPH, where the prostate is already enlarged and pressing against the urinary tube, this additional tightening can further narrow the urethra, making it more difficult for urine to pass through. This can greatly increase the chance of urinary retention, as previously mentioned. 5. Nonsteroidal anti-inflammatory drugs. Nonsteroidal anti-inflammatory drugs, often used for pain and swelling, work by blocking enzymes known as cyclooxygenase COX-1 and COX-2. These enzymes are crucial for creating prostaglandins, which not only help with pain and inflammation but also regulate blood flow to areas like the prostate and bladder. In non-steroidal anti-inflammatory drugs lower prostaglandin production, they might impact blood flow and inflammation in these areas. This could worsen symptoms of an enlarged prostate or create urinary issues. While some studies suggest NSAIDs could decrease prostate inflammation and improve symptoms, other research indicates long-term use might aggravate urinary problems, possibly due to altered blood flow or other impacts on the prostate and bladder. Moreover, NSAIDs can affect kidney function over time. Impaired kidney function can lead to various health problems, including issues with urine production and elimination. This is particularly concerning for men with BPH, as it could exacerbate their urinary symptoms. Additionally, NSAIDs might interact with common BPH medications like alpha blockers or 5-alpha reductase inhibitors, potentially reducing their effectiveness or increasing side effects. Therefore, men with BPH should use NSAIDs cautiously and explore alternative pain management methods